Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore.
Hey, welcome back to another episode of Superhuman Radio. You know, I have received emails and questions from friends and family members about some recent information that has been publicized in the mainstream media, probably about last month, claiming that women who are on hormone replacement therapy have a higher risk of cancers. I believe they said breast cancer and uterine cancer, and really shaking up a lot of women and making them worry. Those who are on hormone replacement therapy already, causing them to worry and second guess their decision, and women who have not started on HRT to perhaps even not move forward in this. And we want to discuss this today. We want to get to the bottom of it. And I had to find the right guest to have on the show. And I found him. It's Dr. Gino Tutera. He is the founder and pioneer of Sotopelle, which is a unique form of HRT, which they actually place a pellet beneath the skin. And we'll talk more about that in a moment. How are you doing, Dr. Tutera?
I'm fine, Carl. How are you?
Very good, very good. First of all, I'm sure that you're aware of the negative propaganda that was promoted last month, correct?
Yes, and it's just a direct extension dating back to the Women's Health Initiative study that was published a few years ago and has gone through multiple changes now because they found that their research was flawed and their conclusions were, erroneous from what they originally stated.
And I'm familiar with that as well. First of all, they stopped the research short of really elucidating the real value of HRT. But more importantly, explain why it was flawed.
Well, it was flawed, first of all, because it was supported by a pharmaceutical company called Wyeth-Ayerst. And they were trying to promote the safety of their particular estrogen, which is called Permarin, which is a conjugated estrogen that's extracted from pregnant mare's urine. And all the research that's been done that shows all this negative publicity is associated with conjugated estrogen. Now, as we all know, that they basically said because that all estrogen was bad. And in actuality, they did not check any other form of estrogen that's presently, utilized throughout the world. And so they made a blanket statement, which was completely erroneous, because not all estrogens are biologically structured the same. And horse estrogen, in particular, is a very potent breast stimulator. And you would naturally think something that that stimulates breast tissue to an extraordinary degree would, in fact, as you would normally, even your common sense would tell you, if it stimulates breast tissue, you're more likely to get problems with your breast if you use it. And so they were trying to dispel that, but what happened is that they shot themselves in the foot because they found, the findings were such that, that the conjugated estrogens were, in fact, cancer-producing when you link them to a synthetic progestin, in fact. And, they even went so far in the original study to say that it increases your chances of heart attack and stroke. Well, they had to come back and change that because they didn't interpret the data correctly. And what they found is that women who start estrogen therapy found that they had less heart attack and stroke, especially if they started it just after they began their menopause. And the last alteration that we've come through is we found that women who took estrogen only had no increased chance of getting breast cancer in any way, shape or form compared to people who don't use anything. So here we have a study that shook the world, and unfortunately, it has continued to permeate the journals and the media because, number one, they're trying to say that all estrogens are the same, which is completely incorrect. Number two, the assumptions that they made in the original study, two of the main assumptions have already been disproven, and they still hold on to this, this garbage about, all estrogens are the same, and they are not in any way, shape, or form.
Now, let's talk about another thing about things like Premarin and Prempro. These are oral, which means that they're methylated, correct?
Well, they have to be activated in the liver to be able to be utilized, and that means that you have to utilize the liver cell or the hepatic cell to activate these things. And when they do, it stimulates the production of clotting factors, which increases your chance of developing these clots in your legs and those sort of things. So it's called first pass metabolism, and to get to get by that, you need to use a form of therapy that does not utilize the liver for activation.
Right, and for those people who are not aware of this, if you take a raw hormone and you ingest it orally, only about 2.5 to 5% of it becomes biologically active in the bloodstream, because the rest of it is destroyed by the liver. So it's not economical to use these types of hormones orally. So what these companies do is they change the structure gently. They add a side chain to the hormone so that the liver cannot break it down easily. This causes hepatic stress, which also changes lipid profiles and clotting factors and a variety of other things in the liver that are not good. Yet, the medical orthodoxy holds on to these oral hormones as the last bastion for HRT. They do not recognize bioidentical hormones. Why is that, Dr. Tutera? Why won't mainstream doctors just go, you know what, these pills are no good, why don't we go to creams or pellets and so on and so forth?
Unfortunately, the way we're schooled, and they capture us immediately in medical school, the pharmaceutical companies do, and start placing their methodology and their philosophy into our brains from second year medical school on, and they reinforce it after you finish training by bringing you different goodies such as pens, pads of paper, lunches, and they show you these bright 8.5 by 11 glossy results about how they relieve symptoms. Unfortunately, what the education about about bioidentical hormone is absent. We hear nothing about bioidentical hormone because, unfortunately, most of the research that is done in medical schools is sponsored by pharmaceutical companies, and they're not going to shoot themselves in the foot by saying, by allowing that sort of education to be presented. If you're going to find out about bioidentical hormones, you have to basically take the initiative yourself and go out and learn about them.
Now, how did you escape the indoctrination, so to speak?
Well, starting in 1979, it just made, and I'd been out of training now for 5 years, and as I kept using these, traditional forms of hormone replacement, several things didn't make sense. Number one, when I looked at the structure of Premarin and the ratio of hormones within that particular pill, it made no sense because it was almost completely opposite of what the human female makes. Number one. Number two is that we were taught give everybody the same dose, which means that you have to assume then that everybody wears a size 8 shoe, has the same fingerprints and the same physiology, which makes no sense. And thirdly, you have to buy into the fact that all estrogens are the same, and that that there is no other alternative. And lastly, and probably is, were you taught to do this without getting one piece of lab work to document where the deficiencies lie? And we were never taught to do blood work. In fact, we were discouraged from doing blood work by our mentors, and because of the fact they say, well, a woman knows when she's in menopause, and if she comes in and says she's hot flashes, then she's in menopause. Well, unfortunately, that disenfranchised about a significant percentage of women who have all these symptoms, and who could have been treated much earlier with bioidentical hormone and saved them some of the terrible symptoms and problems that they suffered just because they weren't the right age or because of the fact they were still having the occasional period. Because we made a lot of diagnoses in our office of women who were told you're too young to have it, you're too young, or you're still having some menstrual bleeding, so you can't be in menopause. And they, but their blood work showed just exactly the opposite. They had been suffering menopause for years, and so those are the problems that we fight: is pharmaceutical company interference in our education, and the lack of the lack of willingness of our mentors to alter their thinking as well.
All right, we're going to take a quick commercial break. And when we come back, we're going to be talking more with Dr. Gino Tutera. You can learn more about his form of bioidentical hormone replacement therapy, which we're going to talk about later in the show. It's very, very unique. It's called Sotopelle. And you can go to Sotopelle, Sottopelle, therapy.com. You're listening to Superhuman Radio. We'll be right back.